Hi, it's the Micro Mommies, and our civic engagement project is Cleanliness at Phillip Stations by Jay, Denise, Jasmine, Eleanor, and Michaela. What's the problem? What's so important about hygiene at Phillip Stations? As a growing and thriving community, our modes of transportation have become many and more efficient. In doing so, vehicles have become a near essential part of our daily lives. This means that gas stations and charging areas now serve as a main point of common contact for our community.
So what's the point? Ever since the spread of COVID-19, the fear of spreading and contracting harmful bacteria has become prevalent among the everyday consumer. And in a world where we are constantly on the move, nowhere quite collects germs like the pump station. Our goal is to identify how much bacteria is growing on these stations and assess how they compare to those of newer, less common modes of vehicles, such as electric vehicles.
So, what does the research say? In Article 2, can you guess what's 11,000 times dirtier than a toilet seat? You might think dollar bills. Money is considered one of the dirtiest objects since it's constantly changing hands, and with a CFU of 5.2 square inch is certainly not clean. You might think an actual toilet. No one is doubting the disgusting nature of a toilet seat, but even those pools of bacteria only carry about 172 CFU per square inch of space. And you take that and times that by 15,000, you get the gas pump. That's right. The gas pump handle has an estimated 3 million CFUs per square inch of stinky gas bacteria. What kind of bacteria are we talking about? Of those 3 million bacteria, 2/3 were identified as bad bacteria. This included gram-positive cocci and bacilli, which are linked to food poisoning and infections in newborn babies. Are they really all that bad? These microorganisms are particularly concerning since diseases like meningitis and pneumonia, as well as drug-resistant qualities, are associated with these bacteria. From Larry Swartz, since a typical visit to the gas station involves pressing the gas grade button as well as lifting the pump handle, that means, for regular gas, exposure to about 5,267,070 CFUs per square inch, and for premium gas, about 4,034,004 CFUs per square inch. With less used premium pumps were already shown to be added to reduce 2 million CFU by square inch, but well, what about charging stations? Charging stations for Tesla and other electric vehicles were shown to only contain roughly 7.890 CFU per square inch. Article 2. Investigation of SARS-CoV-2 SARS on novel surfaces. There are several ways for transmitting SARS-CoV-2, and the gas pump can definitely be one of them. Using real-time PCR tests, gas pump handles were tested to determine the positive and negative results of the presence of COVID both before and after restrictions were implemented. With behavior change, there was no presence of SARS-CoV-2 on gas pumps, whereas beforehand, they found 5 pumps test positive for their presence on the surfaces. Their research results demonstrate that through public health regulations and observance of health behaviors and implementing specific processes that reduce the transmission chain in gas stations. What did the results say? The results showed that out of 9 fuel supply stations, 36 samples of nozzle surfaces that were sampled to identify SARS-CoV-2 in the conditions before the coronavirus restriction, 5 fuel supply stations were positive for the presence of SARS-CoV-2 on the nozzle surfaces. In the conditions after corona restriction, all samples were negative in terms of the presence of SARS-CoV-2 on the surfaces of the nozzles. Article 3. This is the dirtiest thing at the gas station, and it's not the bathroom. So what's the dirtiest thing at the gas station? Unfortunately, yes, it's the gas pump. Simply put, are the most handled part of visiting a fill-up station. How do they get so dirty? Gas pumps are simply unavoidable and sometimes inconvenient. After long hours driving or while trying to make a quick stop, people don't always have access to soap or have the time to sanitize up. So what do? It's actually quite simple. Brush up on those sanitization practices. Here's what they recommend for being a little cleaner at the pump. Wiping down the pump with a disinfecting wipe before picking up the handle, wearing latex gloves when pumping gas, and using a touch-free payment option at the pump, if possible.
So how well does your community do in keeping clean? We ran the survey. Firstly, who's pumping the gas and when are they doing it? We found the age demographic for our surveying group to be mainly between the ages of 18 and 35, and as expected, the vast majority of them drove gas-powered vehicles. We reported that people pumped once but mainly twice a week, and most often during the late afternoon period. So what sanitation practices do they see at the pump station, and which do they actually follow themselves? Although a large group, 92.2% of surveyors, reported that they had never witnessed an employee partaking in cleaning or sanitation practices, 83.2% of them said that they would use sanitizer when provided. When asked if they regularly use sanitizer now when pumping, only 43.4% reported that they partake in regular sanitizing. And when given further options of sanitizing practices, we still receive a report that 26.5% of surveyors admitted to not using any type of sanitation practices at all. So what does the research tell us? It tells us that 83.2% of people are willing to use sanitizer regularly when provided, but only 7.1% of people have actually witnessed an employee cleaning equipment. Out of the 113 responses we received, 26.5% of people don't use any means of protecting themselves. That means that nearly a third of those visiting fill-up stations don't use hand sanitizers and don't protect themselves when pumping gas. What does this mean for us? It means a small knowledge base. Not many people are aware of all the germs and bacteria and diseases that can be spread to pump station handles. Whose job is it to provide sanitation? It's clear most gas stations will provide the sanitizer, but rely on the customer to take on the proper sanitation practices in the first place. And how do we practice it? Well, it's up to us to educate on harmful bacteria, but also to properly care for ourselves when going about our daily lives. So is there a solution? And what can we do? Well, let's be Oregonians. In states like Oregon and New Jersey, self-service gas stations aren't allowed at all. So we asked some of our community members how they felt about having fill-up services done for us. And surprisingly, 46% of people voted no towards having fill-up services. Maybe it's still an option in the future. So what steps could we follow at the fill-up station? Firstly, take advantage. If sanitizer is being provided for you at the gas station, take advantage of that. Use it. Step 2. Sanitize right, and that means sanitizing before and after handling any portion of the pump. Be extra. Don't be afraid to pull out some sanitizing wipes and some gloves. And mostly, and most importantly, know and educate. Take this information and pass it on. Teach those around you how to be sanitary too. And how can we take it further? Be aware that everyday services can affect your health, even at the gas pump station. Practice. Make sure to set the example and follow these practices yourself. Bring it up. Ask your local and regular fill-up stations to see if they can do anything on their part. And most importantly, keep it up. Don't stop these sanitary practices when there's no pandemic. Diseases don't take a break.